All right, today's Women's Health Wednesday now. Roughly 1 in 8 women in this country will be diagnosed with breast cancer in the course of their lifetimes. And many undergo mastectomies or partial mastectomies as part of their treatment to remove the cancer.
It can be so tough. Back in October, though, Governor Kathy Hochul did sign legislation that ensures breast cancer survivors who choose that reconstructive surgery after a mastectomy, they have proper insurance coverage. But it's not that way for all women across the country.
Right, and as Next Star's Arizo Dose explains, some health insurance companies are making changes that could cost women thousands out of pocket. Take a look.
I'm reaching out to my senators and my U.S. representatives.
Vanessa Vance is speaking out.
I've sent emails
and sharing a very personal story.
And I hope that the right people hear it and can make a change to bring back access and options for patients who need breast reconstruction.
The Austin mom says she found out through genetic testing that she's at high risk for ovarian and breast cancer.
Reducing my risk as much as I can, being present, active, and alive as long as I can be.
She says she recently had her fallopian tubes taken out and is now in the process of getting a mastectomy and deep flap reconstruction surgery. It allows patients to use their natural tissue from the lower abdomen to create a new breast instead of using implants.
Well, I had my plans, I had my team. My surgeons have been guiding me on what's the best surgery for me, but now I'm like, well, how is it paid for?
Vance has insurance, but says she recently found out the surgery is only covered at 70 to 90% after a recent insurance coding change. Some doctors say it groups deep flap surgery with other less advanced flap reconstruction surgeries.
The surgeries that we initially performed removed a woman's muscle. The surgeries that we perform now save a woman's muscle. So they're very different from a patient's perspective, and they are reimbursed differently. But an insurance company asked for a change so that they could pay the same rate for all types of reconstruction.
The Centers for Medicare and Medicaid Services, the government agency that oversees certain billing codes, says the change came after the American Medical Association and the American Society of Plastic Surgeons revised an existing code to include deep and other similarly advanced flap procedures. CMS says this reduces the number of codes and does not change whether the surgery will be covered. But AMA says insurance companies are responsible for payment policies they require for specific medical services. The Plastic Surgeons Group says it did not request a change.
How does this impact access to care for women?
This is really challenging. Immediately, patients will find that their surgeons are having difficulty getting reimbursed for surgery. I've already seen that women around the country are being asked to pay cash out of pocket for these surgeries. And that's basically because the insurance companies have dramatically cut the amount that they are willing to pay for these surgeries. So we're seeing that women are being asked to pay for their breast cancer reconstruction surgery when it should be covered under the Women's Health and Cancer Rights Act.
Dr. Elizabeth Potter is an Austin plastic surgeon. She specializes in deep flap surgeries and says patients in Texas are being asked to pay $35,000 to $50,000 for the surgery out of pocket.
These are patients who have insurance coverage. And because the coverage is so low, the doctors offering to perform those surgeries are not willing to accept those payments.
Dr. Potter says she's continuing to perform the surgery and is trying to work with insurance companies and negotiate on behalf of her patients. She started the Community Breast Reconstruction Alliance, an advocacy group, so women like Vance can have access to all options. So what does this mean for you?
Like a lot of confusion. I don't want to do this in 2 years. I want to do it as young as possible so that my runway is longer for health later on. And so, I'm ready, but will my insurance pay for it?
For more resources and to find all of our Women's Health Wednesday segments online, you can go to news10.com, look for the Women's Health area under the Community tab.